Hello, my name is Neil Bleiweiss. Welcome to my presentation, Emerging Technologies and Learning in Graduate and Professional Health Programs. In this session, we will review some of the current practices in health education, a vision of the future of health education, use of an emerging technology in the classroom and a sample lesson, potential benefits and concerns, and close out with final recommendations. Current practices in health education. The landscape of education and healthcare at the graduate and professional level is a continuously changing arena, necessitated by the ever-expanding and increasing volume of medical knowledge over time. According to a study conducted in 2011, the volume of medical knowledge was projected to double every 73 days by 2020, which requires incredible agility in instruction in order to keep up with the newly acquired knowledge from the numerous research studies conducted in the field by the National Institutes of Health, World Health Organization, and other similar organizations. For instruction to accurately capture this mounting volume, the use of educational technology in graduate and professional healthcare programs is essential for the success of the future healthcare providers in training. At this time, the primary forms of instruction outside of standard lecture material that utilize technology are the use of augmented reality, AR, virtual reality, VR, or simulation. The use of augmented and virtual reality allow for students to experience highly detailed visualizations of learning material while also being able to practice clinical skills in low-risk environments that can serve to either augment or simulate real-world settings. The use of simulation is used primarily in three ways: case study, in which students apply knowledge to a presented case in class; mannequin simulation, in which students work with mannequins that are capable of performing many human functions, including breathing, bleeding, or even giving birth; and standardized patients, where students work with live people who have been trained to act through different types of illnesses and ailments for students to interact with. These technologies and methodologies are in use so that students are able to not be squeamish and can be comfortable when moving into a real clinical space to work with real patients and currently practicing healthcare providers. Vision of the future. Future of health education, there are several elements that can be put in place to help students better learn their clinical skills. This includes the use of the four components of instructional design model, or 4CID, which allows students to better understand the use of just-in-time information and work on whole task learning by breaking learning material into four components: learning task, part task practice, supportive information, and procedural information. By using 4CID and further separating out learning content within a semester with part task practice and gradually building on skills, students will be able to reduce their cognitive load and therefore reduce their burnout as they move through their curriculum. The use of problem-based learning, or PBLs, is already in use in medical education today. However, increasing the use of PBLs in the curriculum will also help students to experience more situated learning that can be directly applied to their real-life clinical experience. In addition to these curricular changes, further implementation and embracing of mobile applications and M-learning will help to augment the curriculum for instructors and assist students in developing additional skills. Use of emerging technologies and sample lesson. Mobile applications and M-learning have been determined to have many different applications within the learning environment, and the same holds true for their roles in health education curricula. Some potential applications of this technology include its capacity to further supplement AR and VR learning, but also to offer streamlined techniques and methods for tasks in clinical simulations, such as diagnostic interviewing, patient history taking, or even recording student-patient interactions for self-assessment and review. In addition, mobile applications for learning support informal learning and performance support, which can help to improve and maintain some of the clinical soft skills a student may work on outside the classroom. Primarily, mobile applications serve to augment, supplement, and enhance the curriculum, providing space for additional course content and activities that may have low risk, even facilitating additional opportunities for self-assessment and evaluation of learning, as can be viewed in the following sample lesson. Sample lesson, Medical Spanish Mobile Application. Target audience, first and second year medical students taking Doctoring 1 and 2 courses. In these courses, students work heavily on patient interactions, ethics, cultural competencies, and humanities skills related to medical practice. Curricular implementation. Instructors will implement this lesson to complete during the second half of the semester after students have been introduced to basic skills such as patient diagnostic interviewing and history taking. Students will be expected to complete the activity and provide screenshots of their lesson completion to their professor for credit. After completion, students are encouraged to revisit the application frequently to stay up to date on their basic skills for communication and practice within the clinic. The lesson consists of 3 parts. In Lesson 1, students complete a basic polite Spanish unit in which they review topics such as greetings and salutations, introductions, making requests, and similar types of responses. In Lesson 2, students follow this content by reviewing basic verbs and verb conjugations, including the 20 need-to-know verbs in Spanish from Babbel.com. In Lesson 3, students move into basic medical Spanish, where they will learn diagnostic interview and history-taking questions and responses, as well as basic prescriptive questions. Each learning object consists of audio recognition in Spanish and English, visual recognition of typed phrases in English requiring either a verbal or a typed response in Spanish, and fill-in-the-blank statements. Lesson 3 also includes a short video of basic medical Spanish, a short clip of which can be seen on the next slide.
Hi, Alex.
Hola, Alex.
How are you feeling?
¿Cómo te sientes?
I don't feel well.
No me siento bien.
I need a doctor.
Necesito un doctor.
What are your symptoms?
¿Cuáles son tus síntomas?
I feel a sharp pain here.
Siento un dolor intenso aquí.
My head hurts a lot.
Me duele mucho la cabeza.
This lesson is primarily supported by the cognitive and constructivist learning theories. The cognitive theory in use includes the reinforcement of language into the working memory of students for encoding into long-term memory, and the lessons have been split to be reviewed separately to help students develop basic schemas of the learning content and to reduce their overall cognitive load. The constructivist theory in use is situated learning in that students are using phrases commonly found in the clinical setting. There are several examples of medical Spanish applications with various functions already in existence. 2 such applications primarily intended for translation use in the clinic are Care to Learn and Metababble, which is pictured here on this slide. Two additional applications that provide similar resources but are primarily intended for vocabulary and phrasing searches are the Spanish Medical Dictionary and Canopy Speak. Potential benefits and concerns. The use of mobile applications and M-learning offers several benefits and concerns for use in the health education curriculum. Some benefits include that the content, if developed internally, can be audience-specific to an institution, and also can then lend to in-house design capability to maintain brand standards and content. They also offer potential ease of maintenance and upkeep as the content can be updated internally, while also addressing a critical area in healthcare. Per the 2020 US Census, 22.5% of Florida residents are Spanish speakers. Additionally, per the Department of Health and Human Services, as well as the National Council on Interpreting in Healthcare, if students are able to learn basic foreign language interpreting, they may be able to act as an ad hoc interpreter in the event of an emergency prior to a qualified interpreter arriving on site. Some concerns, however, include that the development of an in-house application can be time-intensive and may potentially take additionally extensive fiscal resources to develop the content and application itself. Additionally, any in-house application would need to be set up to the standards that are required by Health and Human Services and the National Council on Interpreting so that a clinician could effectively serve in that ad hoc capacity, and would also require regular upkeep to keep pace with the evolution of the Spanish language and the continuous increase in medical knowledge. It would also be critical that students have access to the mobile technology needed, and that instructors are able to find space in an already packed curriculum to include the activity. Final recommendations. It goes without saying that one of the most critical pieces for success in the future is to continue to include instructional designers and educational technologists in not only curriculum development, but in conversation of curriculum design as medical education continues to evolve. Health curricula can also benefit from further implementation and utilization of the PBL format and more situated learning opportunities in basic science coursework taken within the first 2 years. The health science curriculum already utilizes multimedia and simulation technologies, so allowing instructional designers to be able to converge this content will help to effectively create learning content and material for the health students that come down the line. Thank you for listening to my presentation. Please feel free to leave any questions or comments in the replies below. The future of healthcare starts in the classroom.